Stress is a continuous problem that affects the lives of every man and woman that presides on this earth. It is a factor that is undoubtedly a part of daily life in general. Due to the many problems that compile in a person's daily routine, tremendous amounts of stress can erupt from an individual's deepest crevices. This concept is perceived and managed in several different ways. The cause and effects of stress may be numerous, but one's ability to cope with this internal conflict is crucial in maintaining a healthy living. In order to comprehend the significance of stress requires a general understanding of the concept. Stress is a term that is widely used, but its true meaning remains a mystery. According to Dr. Jeffrey Scott, a family practitioner who has practiced medicine for 27 years, stress is your body's way of responding to any kind of demand. It is often linked with negative conditions or emotional states such as fear, panic, and tragedy. Stress is not a new phenomenon that suddenly appeared over the course of time. Stress is the body's reaction to change that requires an adjustment or response. This implies that the body reacts to these changes with mental, physical, and emotional responses. People experience multiple forms of stress at home, work, in social settings, and when engaged in activities that promote fun, such as playing sports. Not everyone experiences the same amount of stress on a given day. Psychological and physiological stress emerges as a direct result of an accumulating deficit between daily demands and coping resources. In today's unstable economy, it is damn near impossible to avoid stress. Many have attempted this strategy, but soon discover that avoidance techniques usually generate more stress rather than reducing it. An ideal way to address this concept is in terms of stressors and stress responses. Stressors are events that threaten or challenge a person. They are typically viewed as the direct source of stress, such as having to make decisions, being engaged, and natural disasters. Stress responses, on the other hand, are behavioral, psychological, and physiological reactions to stressors. This consists of concentration difficulties, muscle tension, depression, and anxiety. It is imperative that we acknowledge the fact that on a given day people are affected by events that happen to them directly, as well as those that have taken place within their environment. This process also involves the things we do to ourselves as well. For those wondering if this entails substance abuse, your answer is yes. Here is a list of stressors everyday people experience. Acute time-limited stressors are anxiety-promoting situations. They involve having to speak aloud in public settings or solving a math problem with multiple steps. Brief naturalistic stressors embody serious challenges, such as taking an SAT or meeting a deadline for a major project. Stressful event sequences consist of difficult consequences. This level of stress ranges from natural disasters to traumatic occurrences, just as the passing of a loved one. Those exposed to this type of stress know their difficulties will cease to exist at some point in time. Chronic stressors are identified as ongoing demands brought on upon by life-altering circumstances. A good example of this type of stressor would be a permanent disability caused by an accident or having to become a care provider for an immediate family member with dementia. Individuals who find themselves trapped in this type of situation have an extremely hard time coping due to the fact there is no actual endpoint made clear. The final stressor I would like to dissect is known as a distant stressor. These stressors are created by traumatic experiences that may have occurred in the past, such as child abuse. The psychological impact from this experience carries over to present day. For those who are under the assumption that stress is merely something that makes you worry, your perception of this concept is ill-conceived. We have already recognized stress as a variety of different components. The crazy thing is, many people carry enormous stress loads and they don't even realize it. Common symptoms of stress include a fast heartbeat, headaches, back pain, fast breathing, upset stomach, nausea, and diarrhea. These are just some of the multiple changes one body endures because of stress. Over time, stress may affect your immune system. Continuous stress actually makes the body more susceptible to getting sick. For those who have chronic illnesses such as cancer, stress can lead to the worsening of these symptoms. When it comes to the heart, stress is associated with high blood pressure, abnormal heartbeats, and the hardening of arteries. This can eventually lead to coronary artery disease, heart attack, or even heart failure in some cases. I think it's safe to say we have all experienced states of frustration as well as periods of crankiness. These feelings or emotions cause us to lose our tempers and yell at others for no apparent reason. How many times have you found yourself full of energy one second and several minutes later exhausted and ready to lay down? These events are signs of stress due to the fact this behavior stems from our perception, actions, and inner feelings. These emotions make it harder to focus on tasks and may cause us to worry too much about little things. The way stress affects a person depends on several unique factors. The first factor is an individual's personality. I honestly doubt this subject will require much explanation. I am under the assumption that everyone knows that not one person is the same. We are genetically engineered to have our own feelings and viewpoints. As humans, we learn from those in our environment, especially our family and friends. This explains how we learn to respond to stress from those in our environment. People pick up on others' behaviors and imitate their responses and actions. The last factor I want you to take into consideration is how people think about and handle stress. The notion behind this concept is often misunderstood and guided by one's perception of the term. This opens up a gateway for misinterpretation and confusion 9 times out of 10. As I stated previously, stress becomes harmful when people use alcohol, tobacco, or drugs to try and relieve their stress. Unfortunately, instead of relieving stress and returning the body to a relaxed state, these substances tend to keep the body in a stressed state and cause more problems. Consider the following. 43% of all adults suffer adverse health effects from stress. 75% to 90% of all doctor visits are stress-related ailments or complaints. The Occupational Safety and Health Administration declared stress as a hazard of the workplace. Stress costs American industry more than $300 billion annually. The life prevalence of an emotional disorder is more than 50%, often due to chronic, untreated stress reactions. Although stress is an element that is unavoidable, there are several coping techniques designed to combat its devastating long-term effects. These procedures may alienate its effects altogether, but they do not help in managing the stress load that compiles from everyday life experiences. The best way to manage your stress is to learn healthy coping strategies. Stress relief techniques focus on relaxing your mind and body. Here are some ways you can relax your mind. Writing. It may help to write about things that are bothering you. Writing for 10 to 15 minutes a day about stressful events and how they made you feel is beneficial. Try thinking about starting a stress journal. This helps you find out what is causing your stress and how much stress you feel. After you know, you can find better ways to cope. Let your feelings out. Talk, laugh, cry, and express anger when you need to. Talking with friends and family, a counselor, or a member of clergy about your feelings is a healthy way to relieve stress. Do something you enjoy. This can be a hobby such as playing sports, a creative activity such as writing, crafts, or art, spending time with family and close friends. These activities have been found to help lower one's level of stress as well. It is important to focus on the present. Meditation and guided imagery are 2 ways to focus and relax your mind. When you meditate, you focus your attention on things that are happening right now. Paying attention to your breathing is one way to focus. With guided imagery, you can imagine yourself in any setting that helps you feel calm and relaxed. You can also use audiobooks as a teaching guide. Regular exercise is one of the best ways to manage stress. Walking is a great way to get started. Even everyday activities such as house cleaning or yard work can reduce stress. Stretching can also relieve muscle tension. Breathing exercises, muscle relaxation, and yoga can help relieve stress. These techniques combine exercise and meditation. You may need some training at first to learn them. Books and videos are very helpful. The best part of all is the fact that all these techniques can be conducted from the comforts of one's home. Stress can affect you both instantly and over time. In a way, this phenomenon should be considered a proxy killer because the majority of the time stress goes unnoticed and secondary causes, which have been induced, aggravated, and sustained by stress, take the blame for the individual's ill health. Stress is a result of any physical, chemical, or emotional facet that causes the body or mind unrest. Physical and chemical elements that generate stress include trauma, infections, illness, and injuries of any type. Emotional causes of stress and tension are numerous and varied. Many of society's inhabitants associate the word stress with a psychological context. Scientists and physicians, however, use this term to denote any force that impairs the stability and balance of bodily functions. The most important objective for those under stress is the management of stress in general. Total elimination of stress is an unrealistic goal due to the fact this element is a part of normal life. Instead, we must learn to manage stress so that we have control over its effects on our physical and mental health.